Dr. Ada Uzodi is a pediatric infectious disease specialist at Our Lady of the Lake Children's Hospital in Baton Rouge, Louisiana, in the United States. She had her fellowship training in infectious diseases at the Mayo Clinic in Minnesota, and before that she did a general pediatrics residency at the Children's Hospital of New Jersey. She joins us to talk a little bit more about this issue of children and the possibility of them responding or resuming school at this point. Good evening, Dr. Uzodi. Thank you so much for your time. Let me quickly begin by asking you that earlier in the program I spoke to Mr. Lawrence Akitoko, who said, well, it's still being discussed, the issue of schools reopening. Is that a safe option to consider at this point in time?
Thanks for having me. I'd like to say yes. A lot of pediatricians and health officials share the same concerns that perhaps if we reopen schools, we are going to run into some problems along the line. And the reason we're worried is because when this pandemic first started, we felt that children were having it easy. Many children had mild disease, if at all. A lot of children were asymptomatic, and we were thankful. But in the last few weeks, we began to see children presenting with very odd syndromes. There's a syndrome which we now call the multi-system inflammatory syndrome, which is abbreviated as MISC. So we're beginning to see children presenting in ways that we had never seen. And that made us say, well, let's take a step back and, rethink the whole idea of, reopening schools. We're concerned that there might be, a second spike, if you may call it that, where, children are getting sicker as opposed to now where it's mostly affecting adults. So yeah, we do realize that children need to go back to school eventually, but we want it to be done safely.
What are the precautions? Because back here in Nigeria, for the first time today, the federal government has brought to light the idea that it is now thinking about reopening the schools, and it has put forth some of the guidelines that it hopes to accomplish before those schools can reopen. So the question basically is, what precautions would you recommend, given the background that you've given? What precautions, specific precautions, would you recommend that need to be taken before the various levels of schools are resuming?
So the CDC over here has issued a guidance document which specifies what metrics that they're recommending to states and school districts to go by before they reopen schools. So I'm going to draw from that because that's a very good guidance document. And basically what they're recommending to states, because ultimately it's going to be adapted to state and local transmission levels. So what they're recommending in general is that before you reopen schools in a state, that there has to be a decline in your case counts over a 28-day period. So that's number one. So when states feel, okay, we have met that metric and we're going into what we call over here the phase 2 of reopening. And then the second thing is that before schools reopen, there has to be some safety measures put in place. And, there's a long list of what those measures might be. So number one is that the school has to ensure that there's a protocol in place to screen children when they arrive, screen staff when they arrive, and also have a protocol to identify and, address a child who does come down with symptoms. And then we can go into other protocols that some of your previous speakers have touched on, hygiene in the school, social distancing, disinfection, and what have you. So my recommendation would be that whatever policies we're putting in place in Nigeria sort of mimic, even though I know we have to adapt it, to what's going on in Nigeria, but, we have to consider that we do want a decline in the case count. And we have to be able to test, identify people who are sick, and isolate them effectively.
Do you have any concerns about what is being referred to as reverse infections, which are the situation, especially at the lower levels of education, particularly creches, nursery, and primary schools, which is where the children who are not necessarily symptomatic and who probably have greater chances of recovery may in fact pass on COVID-19 if they had to teachers and so on who are probably much older and who may in fact be vulnerable?
Yeah, that's a great question. When this pandemic first started, we did notice that a lot of children are what we call vectors, so they're asymptomatic, but they're shedding the virus. And in a household or in a setting where there's adults or the elderly or other people who are high risk, these children may infect them unknowingly. We don't have a good answer as to how to address that. Obviously, if the child has symptoms, that's an easy answer. You can isolate that child. But in a scenario where the child is infected and shedding and maybe infecting other people without you knowing it, there's really no way to know. And that's why those preventive measures that everybody's talking about is very key. So in a creche or in a daycare setting or in a school, the staff who work with these children have to ensure that they abide by all the recommendations. They have to practice hand hygiene. They have to wear cloth masks. If the child is old enough, if the child is older than 2 years old and can wear a mask, ensure that the child is masked at all times. One of your earlier speakers talked about not allowing shared toys. If it's a plush toy like a teddy bear that you can't properly disinfect, those should not be allowed. So we have to be more careful in that setting where the child might be the source, but you may never know. So you have to heighten those hygiene measures even more in that kind of setting. Lastly, if there are staff who are high risk, perhaps they have cancer or they're immunocompromised, perhaps that staff should not be working closely with children. Perhaps they can work from home or do other activities that do not bring them in contact with children.
A long list, and shows that probably there is some time to go before all of this is in place and schools can reopen safely and with the assurance that all those who are involved will be very well looked after. Dr. Ada Uzodi, thank you so much for your time, and we trust that you stay safe out there. Thank you so much for joining us.
You're welcome. Thanks for having me.